CF diagnosis, understanding your genetic test results. Understanding genetic test results for cystic fibrosis can be a journey filled with questions and insights. Genetic testing focuses on the CFTR gene, which is responsible for cystic fibrosis. This test looks for mutations that lead to the disease. However, interpreting these results is not always straightforward. It requires a careful look at clinical symptoms, other diagnostic tests, and the specific mutations identified. A cystic fibrosis diagnosis often starts with clinical symptoms and functional tests, such as the sweat chloride test. This test measures the amount of chloride in sweat, which is usually higher in individuals with cystic fibrosis. Another test, the nasal potential difference measurement, assesses how well the CFTR protein functions. While genetic testing can support a diagnosis, it is not the sole determining factor. Some mutations lead to classic cystic fibrosis, while others may result in milder symptoms or related disorders. Generally, finding to disease-causing mutations supports a diagnosis, but it does not predict how severe the disease will be for that person. Typically, genetic testing begins with a panel that screens for the most common mutations associated with cystic fibrosis. If only one mutation is found or none at all, but there is still a strong clinical suspicion, further testing may be necessary. This could involve full CFTR gene sequencing or looking for deletions and duplications. Specific variants, like R117H and the poly-T tract, can also influence how the disease presents and are important in carrier and prenatal screening. Interpreting these results usually requires expertise from a board-certified molecular geneticist. They will integrate the genetic findings with clinical symptoms. For instance, if known pathogenic mutations are identified in a person showing symptoms, it strongly supports a cystic fibrosis diagnosis. However, if only one mutation or variants of uncertain significance are found, additional functional testing may be needed to clarify the situation. Genetic testing is also valuable for carrier screening, especially for those with a family history of cystic fibrosis or partners of known carriers. If both parents are carriers, prenatal testing can be done using DNA from procedures like amniocentesis or chorionic villus sampling to check if the fetus has inherited the disease-causing mutations. In summary, understanding genetic test results for cystic fibrosis involves recognizing that diagnosis relies on a combination of clinical evaluation, functional testing, and genetic analysis. Two pathogenic mutations typically confirm cystic fibrosis, but the specific genetic makeup does not predict individual outcomes. Starting with mutation panels and considering specific variants that affect disease expression is crucial. It is essential to integrate genetic results with clinical symptoms and family history. Seeking expert interpretation and genetic counseling can help clarify the implications for diagnosis, prognosis, and family planning. This comprehensive approach ensures accurate diagnosis and informed decision-making, acknowledging the complexity and variability of cystic fibrosis genetics.